Hello. Knee osteoarthritis has quietly become one of India's fastest growing health burdens. More than 60 million Indians are living with the condition today, and nearly half of all people above 60 are affected. It's not just an old age problem anymore. Urban lifestyles, obesity, and diabetes have pushed rates up sharply in both cities and villages. Women are particularly vulnerable, with research showing they suffer more and with greater severity, especially after menopause. The result is pain, loss of mobility, and a growing impact on both families and the economy. To help us understand this challenge and the solutions available, we are joined by a very renowned specialist, Dr. Shekhar Srivastava, Senior Consultant and Head of Orthopedics at Sant Parmanand Hospital, New Delhi. With more than 25 years of experience, Dr. Srivastava is a leading specialist in knee and shoulder surgery and a pioneer in robotic knee replacement in North India, having performed over 1,500 robotics procedures in addition to thousands of conventional replacements. Welcome, Dr. Shekhar. We are really pleased to have you today. Welcome. Um,
Thank you.
Dr. Shekhar, whenever we talk about health concerns in the country, we talk about diabetes, obesity, fatty liver diseases, um, but very rarely is knee arthritis spoken in the same league. If you could give us a perspective of knee arthritis problem in the Indian population for starters.
Yeah. So, Shivani, the thing is that it is one of the commonest problem nowadays. Okay, if I talk of the percentage, close to 30% of the population suffers from it after the age of 60. Okay. Now, if you take it in context of our population, which is close to 1.4 billion, so that comes to around 30 to 40 uh, crores, which is a big number. Okay. But the only reason why it is not discussed in the same way as you discuss cardiac problem, because it's not a life-threatening problem. It affects your quality of life. Okay, it makes you less mobile, but it directly doesn't affect the life. Okay, it is not a life-threatening condition. That's why perhaps it's not being taken very seriously. But then coming back to it, because it makes the patient more sedentary, so it predisposes these patients to other problems like the cardiac problem, like obesity. The diabetics need to move because of osteoarthritis; they're not able to move. So it also exacerbates that problem. So it directly may not be life threatening, but indirectly it is also quite severe, and it has to be dealt very in a very early stage. So, so the burden of the disease is quite severe in our population, especially in Indian population.
Okay. No, you very rightly pointed out that it is not life threatening, and hence the perspective becomes different when you view this problem. But when we talk about the burden, do females bear this burden of knee arthritis more than males? Do they suffer more?
Yes, very definitely. So if I talk of the patients which I see in my clinic, so almost 70% of the patients are females. And if I talk of the patients who undergo surgery for this problem, almost 90% of my patients are females. So that shows the extent of problem in females. Now, there are various reasons for that, why females suffer more than males. Uh, One of the factor is a genetic factor. So females are more predisposed to osteoarthritis because of genetic factor. Now, this is something which you can't do anything about. Uh, Secondly, there is hormonal factor. So you know that after menopause in females, the level of estrogen goes down. Now, estrogen is a protector of the joints. So once it goes down, the chances of arthritis, the level of arthritis increases. And then comes your
Hmm.
environmental and social factor. See, we all
Hmm.
know that the nutrition of females uh, in our country is not as similar to that of males. So
Hmm.
the amount of protein and calcium intake in our females is slightly less. So the bones are weak. That also leads to osteoarthritis. Obesity is
Hmm.
percent. If we see the percentage of obesity, that is also more in females. And then the females have got a smaller joint.
Hmm.
So if you have more load
Hmm.
on small area, that again leads to osteoarthritis. So the overall,
Hmm.
if we add all these things, so we see that the level of osteoarthritis in females is much more than in females than in males.
So, the question that comes to my mind, Dr. Shekhar, is that there are a lot of factors that are affecting from nature point of view. We can't battle the nature, the way we are designed, the way the joint is small. But before we get to the cure part or the rehabilitation part, are there any preventive measures that the women could start very early on to kind of at least delay, if not completely avoid knee arthritis?
Yes. So, like in orthopedics or in osteoarthritis, we call them as, so there are two factors. First, as you mentioned, genetics and the shape of the joint. So those are non-modifiable factors. Okay, you can't do anything about it. Okay, so that
Hmm.
is there. But then there are various modifiable factors. Okay, now these are the things which are under your control, which you can manage. Now you have to understand that the origin of osteoarthritis, it starts from your youth. Okay, similar to another very common and very serious problem, which is often ignored, is osteoporosis. Okay, which is also very common in females. We know
Hmm.
that. And both of these problems, the origin starts in the youth. Okay, so you
Hmm.
need to have a proper nutrition in your childhood, in your teens, in your early young age, to have strong bones and muscles. Okay. Secondly, you need to have this habit of exercises. The muscles are the protector of the knee
Hmm.
joint. Okay, we have got quadriceps muscle in front of our joint, hamstring behind our joint. Everyone knows about these muscles. Okay, now these muscles, they protect the joint. Now, if your muscles are weak, then complete load falls on your joint. Okay, so the
Hmm.
forces acting on your joint increases. So you need to have
Hmm.
proper strong muscles. You should be doing proper exercises. You should have your weight under check.
Hmm.
Okay, we know that all the load passes through the
Hmm.
knee joint only. So even a slight reduction in
Hmm.
weight, it really improves your symptoms, because the amount of forces passing through your knee
Hmm.
joint, it decreases. Okay, then again, you also need to have flexible joints. Okay, what happens that when we don't do exercises, our joints become stiff. Okay, you must be feeling it yourself. If you don't exercise
Hmm.
for some time, your joints become feel stiff, and a stiff joint is more prone for injury. Okay, so along with strengthening, you
Hmm.
need to do stretching. And fortunately, we have got yoga, which is
Hmm.
such a wonderful stretching exercise. Okay, so
Hmm.
if you if you take care of all these things, if you take care of your nutrition, especially intake of calcium and protein part, if you keep doing exercises to make your muscles strong, to keep your joints supple, if you keep your weight under check, okay, and if you follow certain uh, joint preserving techniques, especially once you have developed joint arthritis, if you make slight changes in your lifestyle, then it goes a long way in prevention of osteoarthritis. Or even if you have developed osteoarthritis, then that will also help in decreasing the symptoms of osteoarthritis. See, aging is aging is irreversible. And we all know that everyone ages, and with aging, degenerative
Yes.
changes are going to happen. Okay, but if you follow all these things, then the effects because of these problems can be minimized.
Excellent. I'm sure our audience is very pleased and to listen to all the valuable knowledge that you are giving and very inspiring. It gives us hope that if we do, little things of diet, exercise, it goes a long way in managing when we actually get old. So my next question is, uh, regardless of whatever we have done, if one reaches the stage where there is acute stage of knee osteoarthritis or arthritis, what are the options? Non-surgical to begin with, and then later on surgical. We'll get to that a little later.
Okay. So Shivani, osteoarthritis doesn't develop in a day. Okay, it goes through a progression. Okay, so it starts with mild osteoarthritis, moderate, and then it becomes severe, and then you get to see patients who have got this bent knee. Okay, deformed knees. Okay, so it it gives you enough time. So it takes years to develop severe osteoarthritis, and based on the degree of osteoarthritis with which the patient is presenting to us, we tailor our treatment. Okay. So if the patient is coming with early osteoarthritis, very mild form of osteoarthritis, then in that cases, we first examine the patient. Uh, we do all sorts of tests like X-rays, even MRI, and we see that first we rule out that there is no other structural cause of pain. That means that is there is no ligament tear or any bony deformities. Okay. Once that is ruled out and we establish that the pain is because of age-related wear and tear, then we first put the patient on conservative program. Now, this includes again exercises. We teach all of these patients exercises and we tell them that regardless of the fact that whether you require surgery or not surgery, you need to do exercise. Even if you are undergoing surgery, if you want to have good result, you need to do exercises. So we teach them some specific exercises. Uh, we if the patient is overweight or obese, we explain to them the importance of losing weight. Okay? So it needs to be. We tell them that this is a lifestyle problem and it cannot be just cured by drugs or by surgery. You have to take care of your lifestyle also. So we tell them that you need to do exercises, you need to take care of your nutrition, and if you are obese, then you need to take help to decrease your weight. Along with that, then there are some supplements because see what happens. Most of these patients they come after menopause, they are elderly, and you know that in spite of taking all the nutrition, the body doesn't absorb everything. Okay. So you need to give them some extra supplements. These supplements can be in form of vitamin D or calcium to strengthen their bones. Then maybe if there are other vitamin deficiency like vitamin B12, you have to give that also. There are some drugs which are supposed to improve the quality of cartilage. We had them also for some time. So these are various nutritional supplements which we add to the patient and which helps them. As far as painkillers are concerned, we try to keep them to minimum. See, no patient can do exercise if he or she is having pain. Okay, so you simply cannot avoid it. But that is that is given for just a short period of time to tide over that period. And once that is done, then we tell them that if you follow these programs, maybe you cannot stop it, but you can delay the progression.
Right. Sir, let's move on to those cases who have advanced osteoarthritis. And even when I meet people, I feel as if every fourth or fifth person I meet has undergone knee replacement surgery. So can you share insights about what this surgery entails? What is a knee replacement surgery? It is so commonly talked about, but I don't think many of us really understand what is the knee. Is it a small part of something that is being replaced? What is that surgery?
Okay. So first of all, let me clarify that it's not that every patient undergoes knee replacement surgery. If we talk of the burden of osteoarthritis, it is say around 20 to 30 crore people are suffering from it. If we talk of the number of knee replacement surgeries happening in India, it's close to, I think, 7 to 8 lakhs per year. Okay. So a very minuscule
Okay.
percentage of osteoarthritic patient, they undergo knee replacement surgery. Okay. Now, let me again clarify that knee replacement surgery is a wonderful surgery. It is one surgery which dramatically changes your quality of life. But very few people ultimately require knee replacement surgery. Now, knee replacement surgery doesn't mean that we take out your knee and we put another one. Okay, knee replacement surgery is basically a knee resurfacing surgery. So, suppose this is your knee joint and the surface is gone. Okay, so there is a layer of cartilage over the end of the bone. What happens in osteoarthritis? That cartilage is worn out because of wear and tear. So, what we do, we give shape to the end of the bone and we resurface with a metal part. So instead of cartilage, now we have got a metal part, both on the thigh bone and the leg bone, and in between that is a special kind of plastic which provides a frictionless movement. Okay, so basically, knee replacement surgery is knee resurfacing surgery. Now, this knee resurfacing surgery is also of two types. One is partial knee replacement surgery, and second is full knee replacement surgery. So, if we resurface the whole of the surface, that is your knee replacement surgery, full knee replacement surgery. But what happens in many cases, you see that only a part of the knee is involved. The inner side of the knee is involved. The outer side is fine. So there we replace just the inner part of the knee or just half of the knee joint. So that we call as partial knee replacement. Now the advantage of partial knee replacement is that because you are just replacing a part of the knee joint and rest of the knee is intact, so the feeling is very natural. The patient recovery is faster. The patient feels as if his knee is as close to natural as possible. You can never say that it's natural, but it feels very natural in comparison to total knee replacement. But then there is only a subset of population who fit into this category, and in those patients we do partial knee replacement.
Dr. Shekhar, we have spoken about how diet and exercise can, and certain kind of medicines also can help manage the knee osteoarthritis. You've also spoken about surgery, but are there any other non-surgical methods which can give you a more stronger solution and lasting solution? If somebody,
Yeah,
especially if
so
somebody is more averse to going to surgery.
yes, yes, you're right. So yes, so we have few other options also. There are some patients who are having many other comorbidities. If the patient is having, say, a cardiac problem and is not fit for surgery, okay, or any other chronic problem which makes that patient unfit for surgery. So you cannot just leave the patient like that. कि मैं तो कुछ नहीं कर सकता. Okay. So in that cases, sometimes what we can do, we can give some injections in the joints. Okay. Now these injections are of different type. In early arthritis, we have got injections which we call as viscosupplement. Now, what these does, these are basically gel-like injections, and it provides mechanical relief. So it provides a cushion between the bones, and that gives relief to the patient. And usually it works for around 1 to 2 years, and it can also be repeated. Okay? Then another type of injections are your growth factor concentrates. So this is very helpful in early arthritis. So what we do, we take out your blood, we centrifuge it, we take out the growth factors in your blood, and then we inject it in the joint. So it helps in healing of the cartilage. It works in young patients with arthritis, where we expect that the healing will be good. But in severely elderly patients who are not fit for surgery, there we give steroid injections. Okay, now there is a lot of misconception that steroids are not good and they should not be given. Well, steroids are also drugs if they are used judiciously. What happens that there are persons who use them indiscriminately, which has given a bad name to steroids. But if used judiciously in elderly patients, especially those who are not fit for surgery, it can give good results. You cannot repeat them again and again, but maybe an injection or two in a year, it really gives them relief and it doesn't causes any harm inside.
Right. I like the fact that you use the word judicious use of steroids. I think that is the key, and that applies to pretty much everything we do in life, whether we eat, drink. Sir, next question. We've heard about robotic surgery, and knee replacement surgery is one of, I think, one of those surgeries where robotic technology has made true inroads. I'm sure our audience would love to know what is this robotic surgery? How the surgery actually takes place? Is there a robot standing next to you? What is it?
Yes. So, so, uh, so basically, when we talk of robotic surgery, we talk of the newer technologies which are now available for knee replacement surgeries. Now, as I told you earlier, that knee replacement surgery is a knee resurfacing surgery. Okay. So what we do, we take the knee joint, we open up the knee joint. So suppose this is a knee replacement surgery. Okay. Now we prepare the end of the bone like this, and over that we put a cap. Okay. So that's the capping of the knee joint that forms your knee replacement surgery. Now, in order to put the cap, you have to prepare the end of the bone. Now, that is the most important part of the surgery because the cap is going to fit exactly like a glove for that part. So, when we use robot, we basically use robot to prepare the end of the bone. So, we do CT scan of the patient. We calculate the alignment of the limb because mostly what happens in osteoarthritis, the alignment of the limb is also deformed. The patient legs are not straight, they have been deformed. So we want to put our implants in such a way that once we put it, automatically the alignment becomes straight and the balance between both the two legs becomes equal. So with CT scan and software, we can plan that a day before. That in which angle should we prepare the ends of the bone so that once we put the implant, the limbs are straight, the limbs are balanced. So basically, we are doing a virtual surgery before the actual surgery. Okay, that is done on a 3D virtual model over the software. Next day, when we do the surgery,
Yeah.
it's we who are doing the surgery. Let me clarify that. We open up the joint, okay, and then we take the help of robot to prepare the end of the bone. So we are able to execute our plan to the millimeter. So that's why once our
Right.
implants are placed in proper alignment, then the functional recovery will be good and a well placed implants last longer. Okay. Because whenever we do knee replacement surgery, we have two aims. Patient should get good pain relief and the implant should last his lifetime. Okay. So if your implants are well aligned, then the longevity of these implants increases. So that's how it helps. That's how this technology is helpful in knee replacement surgery.
I'm very when you said that you do some virtual preparation, it's like working on the digital twin. It's like us giving prelims before the actual board exam. And the other thing which I've understood is that the robotic part is to get the precision which a robot can deliver.
Yes,
And thirdly,
yes.
which I yeah, thirdly, which I it was a question in my mind. You said it should last longer. Is it that if a person, for example, has done this surgery at the age of 60, the shelf life of robotic surgery, I mean, knee replacement surgery is around 20 years, then they have to repeat it, or it can last even longer?
Okay. So Shivani, let me answer this question in terms of statistics. Okay. Now, what the literature says. So the literature says that the 85% survival rate of knee replacement surgery is 25 years. Okay. So what does that mean? That means that at the end of 25 years, 85% of the implanted knees will be surviving. 15% will require revision for some reason or other. Okay. So that reason can be either loosening of the knee, which can happen over a period of time, and that revision can be because of any fracture or trauma. That reason can be because of any infection. So these are the three main reasons of revision. So 15% of the knees, they require revision. 85% of the knees, they are surviving at the end of 25 years. They can survive for 28 years. They can survive for 29 years. They can survive for 30 years. We don't know. But uh, that's the that's the that's the thing with statistics. We will take only those cases as revision, as failure where revision has happened. But if the patient is not surviving, that means it is a success. Okay. So
Correct.
almost 25%, 15% of the knees require some sort of revision. 85% they are surviving in 25 years. Now, with robotic technology, we expect these knees to last longer. These are the statistics with conventional knee replacement. With robotics, we are expecting it to be more. Why? Because younger and younger people are now coming for surgery, and their demands are also much more. Unlike previous set of patients who just wanted to walk normally, climb stairs, these days the younger people have more demands. Uh, they want to pursue some sort of sports, and they are going to use their knee more actively. So we are expecting that with this technology, it will improve their function as well as the longevity.
Okay. Dr. Shekhar, I'm curious that you said that younger and more younger people are coming to you. Now, these younger people are coming because of lifestyle changes that have taken place over the last, 20, 30 years, the fast food culture and the lack of exercise, or that young people always had, but it was never kind of diagnosed because we never really uh, went and surveyed that population. So, which of the two facts are true, or both are true?
I think I would say that your first part is more responsible for it. Lifestyle changes. Okay. Uh, so if we talk of present day medical ailments, okay, you can place 80% of them as lifestyle problems. Okay. Now, 30 years back or 40 years back, the hospital was full of patients with tuberculosis, malaria, infection, diarrhea, recently, infective problems. Okay. Nowadays, when you go to hospital, what? Diabetes, blood pressure, cardiac problem, spine problem, osteoarthritis, knee. So these are all lifestyle problems. Okay, and so you can very well make out that what's the reason. Okay, so lack
Right.
of exercises coupled with improper nutrition. So so see, it's a paradox that when we talk of malnutrition, it is not because of poor nutrition. Poor nutrition in the sense that it's not कि पहले वो खाना नहीं मिलता था इसलिए malnutrition. Now we have all the options. We can afford everything, but we are opting for uh, dietary items which are not good for our health. So
Yeah,
lack
the
of
rich man's disease,
exercises,
as they say.
sedentary, yes, sedentary lifestyle, and junk food. I think this is a major factor. And the another reason why more and more younger people or more people are opting for knee replacement surgeries because they are seeing that the results are good. The they are able to they see that this person has undergone knee replacement surgery and now he has become so active. He's able to do his activity of daily living in such a normal way. So once everyone starts seeing the results, then they are more confident of the procedure.
True. So, Dr. Shekhar, we are coming to close of the interview, but a final question. We have reached the robotic level in knee replacement surgery. What more is there in terms of future developments in the management of knee osteoarthritis? Something that is being researched, something that is in the making and is going to become even better. What is it that in the future we should be looking out for?
Okay. So, Shivani, orthopedics is a very interesting branch. We uh, we do biology and we also do mechanics. We do a lot of metal work. We use nails, plates, and everything. So, if I talk of the progression, I'll also talk about it in terms of biology and in terms of mechanics. So, in terms of biology, yes, there are many things which are happening. What I feel that gene therapy is going to be a big thing in coming times, as in every other field. We know that there is a genetic factor responsible for osteoarthritis, and there are work being conducted to find out those genes and do some alteration. Uh, then there are research going on in terms of growth factor concentrate, uh, cartilage development, cartilage cultures. So these are the biological method of treatment of osteoarthritis, and they are going to come in a big way. As far as the mechanics part is concerned, well, we see that the robotics are coming in a big way. Uh, there is a lot of development happening in robotics also. It is getting more and more affordable, and more people are now opting for it. More and more surgeons are now using it. So it makes planning very simple and accurate. It makes placement of implant very accurate. Then there are developments happening in terms of implants which are put. Okay. Now there are fixed. When the knee replacement surgery started, there were only two or three sizes of implant, and you have to put it those implants only, whatever be the size of the patient. But now different sizes are available, and now there is even talk of developing personal implant for each and every patient. We do CT scan, we see what's your knee looks like, and we develop an implant according to that, so that it becomes natural. So all these things are taking place, and hopefully it's going to help our patients. But still, the thing is that this is one problem where prevention is better than cure. It holds very, very good.
True. True. So, Dr. Shekhar, future holds a lot of promise for those who are suffering, and with the problem only growing in numbers. Technology is going to bring in a lot of benefits. I'm very glad to hear that, and so is our audience. Um, um, I haven't exercised for 2 days, and after this interview, I have just promised myself that today evening I'm going to definitely go and exercise. So, thank you, Dr. Srivastav, for sharing your
Yes.
expertise today. We have really learned that knee osteoarthritis is no longer just a matter of age. It's actually a growing health concern that, as you rightly said, demands early awareness, preventive care, and timely intervention. So, from
Yes.
lifestyle changes and non-surgical therapies to the remarkable advances in knee replacement, including the use of robotic technology, you've shown us that patients have more options and more hope than ever before. So, for everyone watching out there, the message is clear. Don't ignore that little knee pain. Don't delay in seeking help. With the right care at the right time, it's possible to regain mobility, independence, and a better quality of life. See you again in the next episode. Till then, take care of yourself. Good health. Thank you, Dr. Shekhar, once again. Goodbye.
Thank you. Thank you, Joy. Nice talking to you. Thank you.